In this video, we'll review Diabliss Herbal Waters for hypertension management. We've done a clinical trial with 50 subjects consuming herbal waters along with their standard medication for a period of 6 months. The average blood pressure values for the 50 subjects was 172 millimeters mercury systolic and 115 millimeter mercury diastolic, and this would indicate the subjects are in a stage 2 hypertension. All subjects continued to consume their hypertension medication, primarily a combination therapy. In addition, they consumed 15 ml per day of hypertension herbal waters along with mixed with 500 ml water and consumed throughout the day for all the 180 days of the clinical trial duration. The average systolic and diastolic blood pressure values for the 50 subjects lowered progressively, as you can see, during the trial, and was lowered by an average reduction in systolic blood pressure of 48 millimeters mercury and diastolic blood pressure of 34 millimeters mercury by the end of the clinical trial. Further, blood pressure reductions were similar for old hypertensive subjects who were diagnosed with hypertension on an average of 7.5 years ago versus newly diagnosed hypertensives who were diagnosed about 8 months prior to the clinical trial. Diabliss Herbal Waters for hypertension management works equally well regardless of the medication used, as shown here. Systolic and diastolic blood pressure values for all 50 subjects have been plotted from the start of the trial to the end of the trial, and as you can see here, these values have responded for every single subject. 100% of the subjects saw reduction in systolic and diastolic. Also, by the end of the clinical trial, the average blood pressure values for all the subjects was 125 mm systolic and 81 millimeters diastolic values. These findings clearly demonstrate the value of Diabliss Herbal Water as a true supplement or an adjuvant therapy for hypertension management. Thank you.